Hello and welcome. Uh, we should start now. Uh, okay, Rashmi, am I audible to you?
Yes, sir.
Okay. So, have you gone through that aphorism which we in the last class we have discussed, and I have told you to read by yourself? Do you find any difficulty in that?
I didn't complete it, sir. I went through
Okay.
some of the aphorisms.
Okay. Just go through it, and if you people have found any difficulty in those explanations and those aphorisms, just ask me. Okay, so today we will start from, I think it's 60, the aphorism number 60. Please read it.
If these ill effects are produced, as may very naturally be expected from the antipathic employment of medicines, the ordinary physician imagines he can get over the difficulty by giving, at each renewed aggravation, a stronger dose of the remedy, whereby an equally transient suppression is effected. And as there then is a still greater necessity for giving ever increasing quantities of the palliative, there ensues either another more serious disease or frequently even danger to life and death itself, but never a cure of disease of considerable or of long standing.
Okay, again, of a long standing, considerable of a long standing. Okay, whatever good effect we are seeing, whatever good effect we are seeing in the uh, treatment with the antipathic medicines are only in acute diseases. Again and again, Hahnemann have mentioned everywhere that whenever whatever good effect we are seeing, it is in the treatment of acute diseases with antipathic, because it is giving prompt relief, and because the acute diseases are of shorter duration and exhaust by itself. But the in chronic diseases or diseases with a considerable long standing, they cannot be overcome by these antipathic method, and what they will think that they can overcome by giving increased doses. Just we have given examples, we have cited examples of migraine, simple disease, simple headache of chronic nature, headache of acute nature. You can say that they are taking any of the painkiller and it is working, and headache has gone and it is not coming again for considerable long period of time. That was sort of, that is good for only the acute headaches. But the headaches which are of chronic nature, like migraine, stress headaches, and all those types of headache which are due to chronic diseases, uh, they need to increase the doses of painkiller. Clear? And here attached a long footnote to this. This long footnote discusses the Brosseau method. Okay, the method by the same footnote, same kind of footnote you will get in introduction, and I have told you to read it by itself. Again, I will tell you to read it by yourself, and that there is nothing difficulty here in reading that Brosseau was a physician during Hahnemann's time in the Paris, and so when he reached, you will see those footnotes as well as introduction, and in here Brosseau has been criticized only in the 6th edition when Hahnemann have encountered him in Paris. Okay, later on he reformed his treatment. So if Hahnemann would have lived to write the 7th edition of Organon, these footnote may have been uh, excluded from the 7th edition, because Brosseau later on have reformed himself, and these treatments of bloodletting, leeching, hunger diet, and all these. But Hahnemann have criticized him passionately in the 6th edition. You will get these footnotes in the 6th edition regarding Brosseau's treatment. Okay, because at that time Hahnemann was living in Paris, and he encountered his treatment, and he was a Parisian physician, a French physician who was advocating this sort of method. Okay, so read this method. You will get you will get short notes or sometime long question in your undergraduate as well as in postgraduate examination, but it is quite irrelevant nowadays, because no one is practicing these things except somewhat in Panch Tantra of Ayurveda. Have you heard? You must have heard about Panch Tantra therapy of Ayurveda, where they used to do these sort of thing. Okay, bloodletting, cupping, leeching, and all sort of medieval periods. These sort of practices of medieval period is being practiced in this kind of therapy, which is gaining popularity nowadays with the name of Panch Tantra. Okay, so that to some extent you will see the physiological system, so called physiological system. Just underline that word. 1 2 3 4 5 6 7th line, so called physiological system, 7th line of the footnote. Okay, and the only medicine Brosseau was using the Arabic solution, gum solution. So these are important for your theory paper and theory examination. Quite irrelevant nowadays, except that we are afraid that Panchtantra is gaining popularity and these sort of things are being practiced. Now 61.
Had physicians been capable of reflecting on the sad results of the antagonistic employment of medicines, they had long since discovered the grand truth that the true radical healing art must be found in the exact opposite of such an antipathic treatment of the symptoms of disease. They would have become convinced that as a medicinal action antagonistic to the symptoms of the disease, an antipathically employed medicine is followed by only transient relief, and after that is passed, by invariable aggravation. The converse of that procedure, the homeopathic employment of medicines according to similarity of symptoms, must effect a permanent and perfect cure. If at the same time the opposite of their large doses, the most minute doses are exhibited. But neither the obvious aggravation that ensued from their antipathic treatment, nor the fact that no physician ever effected a permanent cure of diseases of considerable or of long standing, unless some homeopathic medicinal agent was accidentally a
Okay,
chief
underline
ingredient in
this
this
again,
prescription.
considerable or long standing. Okay, that shows that in acute diseases antipathic treatments, they are actually not curing in acute diseases, but there is an illusion of cure, because they have suppressed the symptom and disease have exhausted its course. Okay, and underline the capital words, the whole sentence have been written in capital there. Underline that and go on reading next.
Nor yet the circumstance that all the rapid and perfect cures that nature ever performed, Aphorism 46, were always effected by the supervention upon the old disease of one of a similar character, ever taught them during such a long series of centuries this truth, the knowledge of which can alone conduce to the benefit of the sick.
Same kind of thing we have encountered in the introduction. Where we have told? Do you remember? Same kind of thing we have encountered in introduction. For paragraph number 80. Paragraph number 80. Just write here in the margins, paragraph number 80, and refer to that. That whenever there is a in nature, there is a rapid cure, this is due to that your prescription contains some similar medicines. Okay, this was due to the similar affections only. Whenever you encountered a cure, whenever you are encountering a cure, even in allopathic mode of treatment, that chief ingredient of your prescription, here come back to aphorism 61, 1 2 3 4 5 6 7th line from below, 6th line from below, accidentally a chief ingredient, some homeopathic medicinal agent was accidentally a chief ingredient in his prescription. Okay, underline this. Now go to 62. Go to 62.
But on what this pernicious result of the palliative antipathic treatment and the efficacy of the reverse, the homeopathic treatment, depend is explained by the following facts, deduced from manifold observations which no one before me perceived, though they are so very palpable and so very evident and are of such infinite importance to the healing art.
Okay, following facts. Now again, it is a Bhumika aphorisms for what are going to come. What are going to come? Here, actions of medicines. Okay, primary action and secondary action. From here onward, you will see up to 67, the up to 69 even, the actions of drug have been discussed. Okay, following facts, underline that. Again, underline deduced, that is the logic of deduction. Okay, homeopathy mainly, whenever you are asked a question about logic of homeopathy, it is both inductive and deductive, but these laws have been formed by deduction mainly. Okay, by deduction, these laws are, especially nature's law of cure and these medicinal actions have been observed in nature and then deduced. The facts have been deduced and laws have been formed. Okay, so again, deduced. Okay, deduction, logic of deduction have been applied here. From where? These deduced from where? By manifold observations which no one before me perceived. Hahnemann is saying that these drug provings, in cases of drug proving, he is also saying no one before me except Albert von Heller. Okay, here also saying these primary and secondary actions have been not been observed before me. No one have observed this before me. Same thing have been said in the potentization, and potentizations are, Hahnemann at one place is saying that the greatest discovery of all time, potentizations, where Hahnemann is again saying no one before me have think of that. Okay, so these are 2-3 things which are very peculiar to homeopathy, which no one before Hahnemann have perceived, or at least had a law of similars were perceived before Hahnemann, but it was not formed in a system, and Hahnemann formed it in a system with the help of these facts, these logics. Okay, he is forming whenever he encountered any challenge, be it in the relapsing cases where he discovered the chronic diseases, be it homeopathic aggravation where he discovered the potentization. Okay, so Hahnemann have formed his medical system. In spite of that, before him, the law of similars were known to many. Hahnemann have given examples. Law of similars were known to many, but Hahnemann have made it into a system. Okay, and these are the facts and laws Hahnemann deduced from his observation. Okay, so following facts, these are Coming the primary and secondary, discussion on the primary and secondary action. To some extent, we have discussed. Let me bring my dozens. This uh, theory and practice of homeopathy by Dudgeon. In it, you will get a lecture on the actions of medicine. Lecture number 8, page number 212 in my lecture number 8. This lecture is important for those who are having, who are going in, having their postgraduates. Okay, these are not important for those who are in undergraduate. For undergraduate examination or for your undergraduate study, these whatever written in Organon is enough regarding primary action and secondary action. Okay, but those who are doing their postgraduate examination or are going to face their postgraduate examination, they must read this lecture, which is quite large. I will mark some points here what to read. It is almost from 212 to 241. That means it contains 30 pages. Okay, first, before starting this primary and secondary action, open Kent's lecture. Kent's lecture, oversensitive patients. In Kent's lecture, oversensitive patient. Do you have a Kent's lecture?
No, sir, not now.
Not now. Sunil, do you have?
So which lecture oversensitive?
Yes. Eighth paragraph. Eighth paragraph. 1. Oversensitive patient. Chapter number 16. 1,
Yes.
2, 3, 4, 5, 6, 7th. Sorry, 7th or 8th paragraph.
So 7 or 8?
हाँ नहीं सिर्फ देखो 7th में होगा. I am reading it in the 63rd and 64th paragraph. Hahnemann
Yes,
treats
sir.
of primary and secondary actions of medicine.
Yes, sir.
Got it? Okay.
Yes, sir.
Okay. Now read this line. Read this paragraph.
In the 63rd and 64th paragraph, Hahnemann treats of the primary and secondary action of medicine. There is no necessity for dwelling upon this subject. The primary and secondary actions of a drug are simply the one action of that drug. Some homeopaths have attempted to individualize between the primary and secondary actions. It does not matter what the patient is suffering from symptoms which appeared in the primary action or from symptoms which appeared in the secondary action. That drug will cure just the same. The symptoms that arise are the symptoms that arise from the remedy, and they often seem opposed to each other. In the earlier stage,
Wait
we
here
have
only. Wait here only. Just underline these. There is no necessity for dwelling upon this subject. Okay? There is no necessity, for this will put a full stop to all the academic discussion on the primary and secondary actions. Okay? This is totally impractical to differentiate between primary action and secondary action, what you have seen in Dudgeon's lecture of 35 pages. Okay? So for our clinical purpose, this is not at all necessary. For all our clinical purposes, this is not at all necessary. So it will full stop our discussion on the primary action and secondary action for the clinical purpose. Okay, what Kent is saying, the primary action and the secondary action of the drug are simply one action of the drug. Okay, underline that also. Now underline, it doesn't matter what the patient is suffering from. from symptoms which appeared in the primary action or from symptoms which appeared in secondary action. That drug will cure just the same, whether you are getting the primary action, whether you are getting the secondary action. If the drug has it, it will cure. Okay. Now, if you have Clark with you, just open it.
Clark, sir, chronic margin.
No, not Clark. Clark's Dictionary of Mathematics. Clark's Dictionary of Mathematics. Got it?
Sir, I don't have that book.
Oh, acha. So I am reading opium. Okay. Opium. In Clark's Dictionary of Mathematics, opium. Okay. You have to just go through this. Hahnemann in Mathematica Pura sum up the action of opium. Opinion, what actually the primary action and secondary actions are. They are actually the opposite of each other. No.
Sir, you got disconnected.
Okay. Am I connected now?
Yes, sir. Now repeat again, sir.
Okay, I was telling that in class Materia Medica, first we have fixed our base with a Kent's lecture. Okay, that there is no necessity of dwelling on this subject too much. What is primary action, how to differentiate between those, and how to use during our clinic. Okay, so to get a more understanding of it, you need to have go through Clark's Materia Medica, opium, coffea, and Emil Tyler's Materia Medica, opium and coffea. Just go through these in your leisure time. Okay, that is the second thing we have told. Now, what is primary action and what is secondary action? Secondary action you will get actually, which is almost opposite to the primary action, and it is coming after. Secondary action are of two type. We are talking about secondary counter action. Secondary actions are of two type, and we are talking about secondary counter action, okay, which is almost opposite to that of the primary action, okay, which was opposite to the primary action. Okay, yahan tak clear hai? Now
Yes, sir.
there is a thing called alternating action. There is a thing called alternating action. What is that? And how to differentiate between the alternating action and the secondary action? Alternating action is also opposite, but alternating action will keep coming in paroxysm. Okay, it is also opposite, diarrhea and constipation, but it will keep coming in alternating paroxysm. But secondary action is opposite, ये आके रुक जाएगा. डायरिया हो गया, अब कॉन्स्टिपेशन आया, अब डायरिया नहीं आएगा, अब डायरिया आ जाएगा, तो that is alternating action. If diarrhea is not coming, that first symptom was not coming, then it is secondary action. Clear? Clear though?
Yes, sir.
Okay, this is secondary action. Now during our clinic, whatever we are getting, we can prescribe upon it. Okay, you will get the bipolar modalities in your repertory. What is bipolar symptoms or modalities? You will get that a person is having having aggravation by warmth. You will get a symptom in your repertory. Listen carefully, this is a very difficult subject I am discussing. Okay, how we are seeing primary and secondary action. We will go to Organon and make it a bit simple. Okay, but first we are discussing the difficult part. A symptom you are getting in your repertory, that a person is aggravated, a pain is aggravated by warmth. Okay, and you will get a medicine in top grade. Now go to cold. Persons aggravated by cold. Okay, exactly opposite. Aggravated by warmth, aggravated by cold. Exactly opposite. Still you are getting the same medicine with same grade. Okay, what does this shows? This is the maybe the secondary action, and this secondary action is often the clinical observation. Okay, you will get desire for sweet, sulfur, aversion for sweet, sulfur. Okay, and we are prescribing in both cases. Okay, exact opposite modalities you are getting. Okay, brainia to chhod do, alternating medicine hai, having alternating action, so you can get exactly opposite condition, aggravated by rest, and still you can prescribe brainia thinking that this may be an alternating action. But there are medicines which have exactly opposite symptoms what we have read in the Materia Medica. Exactly opposite. You have read in Materia Medica that sulfur is not neat and clean. Okay, dirty patient. Yet you will get a fastidious sulfur patient. in exact opposite to that. What is that? That may be a secondary action, and still you can prescribe with the equal value. Okay, whenever you are getting a bipolar symptom, you say we say now that this medicine have this modalities in its utter form, and if you are not getting, like pulsatilla, thirstless is prompt means boldly written, and still you will get some patient of pulsatilla thirsty pulsatilla. थर्स्टलेस जितना इंपॉर्टेंट था, जितना बोल्ड में था, उतना ही बोल्ड में दिस थर्स्टी इज ऑल्सो देयर. सो थिंकिंग ऑफ दैट, दिस is not going to exclude pulsatilla from your mind, because you are getting other symptoms of pulsatilla and think that this may be a secondary action of that medicine, so you can prescribe. Getting me? So this is the concept of bipolar symptoms. We have given examples of desire and aversion. Desire of sulfur जितना strong है, desire of sweet sulfur में जितना strong है, aversion of sweet sulfur में उतना ही strong है. Okay, so this exact opposite symptoms, if you are getting exact opposite symptom, desire for warmth, warm food, lycopodium में जितना strong है, उतना ही strong desire for cold food है. Okay, why? Because of this secondary action. Clear है? So for all the practical purpose, this is the most probable explanation for that. Okay, where we can utilize our knowledge of secondary action, where we can utilize our knowledge of alternating action in our clinical purpose. But what Dudgeon have told in his lecture, it is very difficult and very confusing. Okay, he altogether rejected the concept of primary action and secondary action. Now open Allen, go to Camphor and read the last line, that is the Herring's comment. Okay, what is that? Go to Allen, Camphor, Herring's comment.
All our progress as a school depends on the right view of the symptoms obtained by proving with camphor and opium. Herring.
Okay, this is who is saying this? Herring. That why he is saying that? Now come to lecture by Dudgeon's primary and secondary action. Okay, 1, 2, 3, 4, 5, 6, 7, 8th paragraph. The discrimination of primary and secondary action was a point of some importance according to Hahnemann, as the choice of homeopathic specific medicine was dependent upon it. For as he says, in the medicine of experience, it is the symptom of the primary action of the drug that should correspond to those of the disease. Underline that if you have. It is the symptoms of primary action of the drug that should correspond to those of the disease, in order that a drug should be a positive or curative remedy and not merely a palliative. Okay, not merely a palliative. So in choosing a symptom for ours, we are choosing the action of primary action of the drug, not the secondary. But what is happening in the narcotics? What is happening in the narcotics?
In primary action, it causes loss of sensitiveness and irritation.
So in proving, what we are recording?
Secondary action. It's secondary action.
Secondary action. In proving, we are recording secondary action. So proving में जब हमारे पास secondary action है, तो हम लोग primary action पे prescribe कैसे करेंगे? How we are going to prescribe on the primary action? Okay, so there is a confusion Dudgeon is raising. Okay, how we are going to prescribe on primary action in cases of narcotics, as we are having only the secondary actions of narcotics. That is why hearing is calling that understanding of opium and camphor and other narcotics you can add to that, that all our progress, itna bada comment, all our progress of homeopathy depends on that. But for all our practical purpose, that part only important what I have said regarding the bipolar symptoms we are getting in repertory. जितना एक्सटेंट में दिस सिम्टम इज है, उतने उसी एक्सटेंट में उसी इंटेंसिटी के साथ उसका अपोजिट सिम्टम भी है. ओके, सो आइदर ऑफ यू आर गेटिंग, you can think of that medicine provided the other symptoms matches. Clear? So the assignment will be, you have to read opium and coffea from M.L. Tyler and from J.H. Clark to form an understanding. Now come back to aphorism number 63. Aphorism number 63.
Every agent that acts upon the vitality, every medicine, deranges more or less the vital force and causes a certain alteration in the health of the individual for a longer or a shorter period. This is termed primary action.
Wait
Although
here.
a
Wait here. Medicine that deranges more or less vital force causes a certain alteration. What kind of alteration it will cause? It will cause alteration peculiar to it. Okay, it is causing alteration peculiar to it. Camphor camphor की तरह करेगा, aconite aconite की तरह करेगा, bryonia bryonia की तरह करेगा, but will alter primarily. That is called primary action. Okay, primary action. And this is in next line. This is the definition of primary action. Diya, medicine diya. There are some alteration in the health of the person. And although this is the product of both vital force and medicine, this is a conjoint action of vital force and medicine. Okay. Product of vital force, listen carefully, product of vital force and medicine. Clear? But it is primarily due to the medicine. Okay, primarily the medicine which will decide. Listen, see here, our medicine is capable of producing these all symptoms, having these all symptoms. Okay, medicine capable of producing these all symptoms. Okay, this is medicine capable of producing. Now this is person, our individual whom we are giving medicine. Okay, now it is acting on this. Okay, this medicine is not going to produce other symptoms except what it is already having. Okay, from this array of symptom it will produce symptoms here only. Okay, but all the symptoms whatever present here may not be produced. Okay, may not be produced. Wait a minute, I will give easy explanation. Suppose 1 2 3 4 5 6. Okay, so here only 1 2 4 5 symptoms are being produced. Okay, but medicine will not produce in this a symptom number 7. A symptom number 7 will not be produced. Why it will not be produced? Tell me. Why it will not be produced here?
because it is not in its nature, it doesn't produce the symptoms.
Very good. Not in the nature of medicine. because it is not here. Okay, okay. Now tell me why symptom number 3 has not been produced.
Because the person is not susceptible to that symptom. For
Very
that
good.
symptom.
Now you understand what is the conjoint. Now you understand what is the conjoint action.
Yes.
Very good. So why it is being called as the primarily due to, although it is the conjoint action of vital force and medicine, but it is primarily due to the medicine. Okay, it is primarily due to the medicine. It is possible that all these symptoms may be produced. All these symptoms may be produced in the person, but it is not possible that medicine is not having that symptom and it is being produced. Okay, clear? So this is called primary
Yes.
action, although it is a conjoint action of medicine and the vital force, but it is primarily due to the action of medicine. Primarily due to the action of medicine. Clear? So now, it is principally due to the former power, that is the medicine, principally due to the former power, the medicine. Okay. Now, idiosyncrasy, you remember idiosyncrasy? That what happened in your idiosyncrasy? Some symptoms are being produced. That symptoms are actually the symptoms of medicine, and that individual were oversensitive to that medicine that is producing all the symptoms. Okay, so idiosyncratic prover are the good provers to us. Kent's ninth observation. Okay, some persons prove all thing whatever they will get. Okay, so it is principally due to the former power. Now stop here and read next. Underline, it is principally due to the former power. Read next.
To its action, our vital force endeavors to oppose its own energy. This resistant action is a property, is indeed an automatic action of our life-preserving power, which goes by the nature of secondary action or counteraction.
Okay, now this secondary action and counteraction, there is a confusion. Secondary action and counteraction. Actually, this should be like this. Secondary action are of two type. Uh, Secondary actions are of two type. Counter and curative. Okay, so you can write here. You can write here secondary action, right? Counter action, and to that or curative action. You can omit this or here, secondary action. You can give a dash here and write counter action or curative action, or better to write counter action and curative action. Both are secondary action. Okay, and this is a product of vital force itself. This is a product of vital force itself, not the medicine. Okay, now go to 64.
During the primary action of the artificial morphic agents, medicines, on our healthy body, as seen in the following examples, our vital force seems to conduct itself merely in a passive, receptive manner and appears
Underline
so
this.
as to...
Permitting the impression, receptive. Underline receptive, passive, receptive. And letting it alter the health of the vital force. Read next.
compelled to permit the impressions of the artificial power acting from without to take place in it, and thereby alter its state of health. It then, however, appears to rouse itself again, as it were, and to develop the exact opposite condition of health, counteraction, secondary action. To this effect,
Okay.
primary action produced upon it.
Uh,
If there
what is A? The exact opposite condition of the health it will produce. Okay. The exact opposite condition of the health, counteraction or secondary action. Same thing. To this effect, yani which effect? Primary action to primary action. Okay. Now read next. Underline that exact opposite condition of health. Exact opposite condition of health. Secondary counteraction. And right here is from Stuart clause. That is, Stuart clause is saying that the third law applicable only here, not in the secondary curative action. Okay. Third law of Newton applicable only here, not in secondary curative action. What is secondary curative action? We will see. Now read.
If there be such an opposite, and that in as great a degree as was the effect, primary action, of the artificial, morphic, or medicinal agent on it, and proportionate to its own energy. Or B. If there be not in nature a state exactly the opposite of the primary action, it appears to endeavor to indifferentiate itself, that is, to make its superior power available in the extinction of the change wrought in it from without by the medicine, in the place of which it substitutes its normal state, secondary action, curative action.
Now we have discussed it before, I think, that if diarrhea, the agent is causing, if the person is suffering from diarrhea, vital force knows that I am suffering from diarrhea. Okay. The agent is coming and causing a constipation. Okay. The agent, medicinal agent, comes and cause a constipation. Okay. Vital force knows that I was suffering from diarrhea, and it saw that the agent come and cause a constipation. What will be the reaction of vital force? It will try to produce more diarrhea against that agent. Okay, medicinal agent. After it exhausts the primary action, the vital force rose itself, an exact opposite condition it will produce. Okay, that is diarrhea. That diarrhea is again more. But if the agent comes and produce a diarrhea, vital force that sees that I was suffering from diarrhea and diarrhea have been produced, so exact opposite condition is not possible in nature. Vital force differentiate itself and let the disease be cured. So here in the curative action, exact opposite action is not there. Okay, exact opposite action is not there in the curative action. So secondary curative action, that is, the vital force indifferentiate itself. In that condition, the agent was producing exact opposite condition. Okay, so vital force reacted to that. How can any other agent can produce this? Okay, so reacted. But here the agent is producing the diarrhea itself. So he vital force know that I am suffering from diarrhea. It's okay. Now because we have artificially produced that diarrhea, the diarrhea will go on by itself, and vital force itself indifferentiated. This is called secondary curative action. Okay, for all the theoretical of undergraduate examination, this sort of explanation will do. Okay, and for all practical exam explanation, this sort of explanation will do. Whatever written here, this is primary action, this is secondary action, this is counter action. Secondary counter action, secondary curative action. Okay, now I want you to note down this also in aphorism number 109. In aphorism number 109. Sorry, experiments. 112. In aphorism number 112. Read aphorism number 112.
In those older prescriptions of the often dangerous effects of medicines ingested in excessively large doses, we notice certain states that were produced, not at the commencement but towards the termination of these sad events, and which were of an exactly opposite nature to those that first appeared. These symptoms, the very reverse of the primary action, 63, or proper action of the medicines on the vital force, are the reaction of the vital force of the organism, its secondary action, Aphorism 62, 67, of which, however, there is seldom
Underline
or
this.
hardly.
Underline this towards the termination of these sad events. Which sad events? The older prescription, large doses. Okay, exactly opposite nature of symptoms will be produced toward the termination of these sad events. Underline that. Exactly opposite nature to that the first appeared. Underline that. These symptoms are very reverse of primary action. Underline that. Are the proper action of medicine on the vital force, primary action, are the reaction of, underline this, reaction of the vital force of the organism, secondary action. Okay, secondary action was coming because of large doses. Secondary actions were coming because of large doses, of which, however, there is a seldom or hardly least trace from experiments. What kind of what we are doing drug proving? We are not giving our medicine in large doses during drug proving. So we are noting down the primary action in moderate on healthy bodies. Okay. So these secondary actions are not coming in drug proving. Why? Because these are we are experimenting with the moderate or extremely small doses. But in older prescriptions, poisoning, okay, in records of poisoning, you will also see that the commencement, what symptoms were coming at the commencement, at the termination, the exact opposite of that have been seen. The symptoms which are coming in commencement was the primary action, and the symptoms which were coming in the termination were the secondary action. Okay. Now again, go to the 130. 130. No, sorry, 137. 130 छोड़ दीजिए, 137 में.
The more
Read
moderate
137.
within certain limits, the doses of the medicine used for such experiments are, provided we endeavor to facilitate the observation by the selection of.
Leave that. That is a line bracket regarding the
Oh,
quality of prover. Okay, quality of prover have been discussed in 126 plus this. So that is for quality of prover. Leave the line bracket and come.
the more moderate within certain limits, the doses of the medicine used for such experiments are, so much the more distinctly are the primary effects developed, and only these, which are most worth knowing, occur without any admixture of secondary effects or reactions of the vital force. When, however, excessively large doses are used, there occur at the same time not only a number of secondary effects among the symptoms, but the primary effects also come on in such hurried confusion and with such impetuosity that nothing can be accurately observed, let alone the
So
danger attending them.
this was the risk of large doses. This was the risk of large doses in our proving. Okay, if you are giving large doses in proving, instead of getting the primary action which is worth knowing, you are getting the secondary actions. Okay, clear? Now go to 131. 131.
If, however, in order to ascertain anything at all, the same medicine must be given to the same person to test for several successive days in ever increasing doses, we thereby learn, no doubt, the various morbid states this medicine is capable of producing in a general manner, but we do not ascertain their order of succession, and the subsequent dose often removes curatively some one or other of the symptoms caused by the previous dose. or develops in its state an opposite state. Such symptoms should be enclosed in brackets to mark their ambiguity
Underline this.
until
Develop in its state a opposite action. Okay, opposite action. जब हम when we are giving some substance in large doses, there may develop an opposite state, which should be enclosed in bracket. Why enclosed in bracket? Because this may be the secondary action of that drug or may be the alternating action. Okay, so it is enclosed in bracket to mark their ambiguity until subsequent purer experiment show whether they are reaction of the organism and the secondary action, reaction of the organism and the secondary action, or an alternating action of this medicine. Okay, so such an opposite state, if you are getting in during drug proving, you should with large doses. Okay, so you should include that in bracket because you don't know whether this is the reaction of the organism or the action of the primary action of the medicine. So secondary action, wherever it has been used, if it has not told that this is secondary curative action, you will mean by it the secondary counter action only. Whenever secondary action is used or the reaction of the vital force used, it means secondary counter action, not the secondary curative action, because in the secondary curative action there is no such opposite state. Clear? So in aphorism number 30, you will learn 130. You will learn the benefit of advantage of giving one dose, first dose. If you are giving 130, aphorism number 130, then if you are giving first dose is strong enough, you will mark the duration of the medicine. Okay, why the duration of medicine is important? And why the succession of the symptoms are important. Succession of the symptom, that these symptoms come first and these symptoms comes last. In Materia Medica Pura, when you will go, I think we have discussed or not, but let's see the Materia Medica Pura here. You will get after 2 hours. Okay, I am seeing this opium. Okay, leave the opium. Opium will cause confusion to you. Just go to any other drug. See this symptom number 473 of pulsatilla after 24 hours, after 4 to 5 days, after 1 hour, this symptoms. Okay, this symptom after 1 hour. Okay, after 1/4 hour. Okay, that is after 15 minutes. This, so if you are giving, this is a side topic we are discussing. The side topic was primary action and secondary action. Now we went to the drug proving and we have discussed the secondary actions and primary action, and when these are coming and what are these in respect to drug proving and what are noted and what are not noted. We have already discussed that in narcotics we are noting down the secondary effects. Now we are a side topic we encountered, that the succession of symptoms, the duration of symptoms 130. That is why we have kept it for last. We have discussed all the aphorisms regarding our actions of drug but kept 130 at last. This is the advantage of strong dose, that we are getting the duration of the medicine. What is duration of the medicine? Means a medicine, how far it is working, how many doses a medicine can work, that we call duration of medicine. Okay, wait a minute, I will come. Wait a minute, I just bring that table where the duration of medicines are mentioned. This one. See the duration of medicine. This table was in the Borix Materia Medica compiled by Gibson Miller, and he gave the duration of medicine. This medicine, this acid nitric, working for 40 to 60 days. Okay, so this duration of medicine can be known by subsequent experiment. Go to 130 last line and you will see that duration of the action of a drug only be ascertained by comparison of several experiments. So duration of the action of drugs are necessary to know, and as well as the duration, as well as the succession of symptoms are necessary to know. Which symptoms coming first? Do you know that why this action of succession of symptoms are important?
To know whether the cure is taking place or not.
No, that is the symptoms of disease. The symptoms of disease will disappear in reverse fashion. Symptoms of
Yes.
disease will disappear in reverse fashion. That is for the cure, Hering's law. But why
Yes.
the this succession of symptoms are important? This is because late appearing symptom. There is a book, Bonning Hassan's Laser Writing. Those who are in their postgraduate examination, they should refer to it. Chapter Borax. Chapter Borax. Bonning Hassan's Laser Writing, where it has been mentioned that late appearing symptoms are important. Late appearing symptoms are more characteristics. Okay, and you will get in Hering's writing somewhere, I forgot the source, but Hering once told that this late appearing symptoms, that those symptoms which are appearing at the end of the proving, towards the end of the proving, are more important. So you have to refer Borax, Bonninghausen's laser writing. You will get this Borax, chapter Borax. Okay, just go through that. So the succession of symptoms are important because you need to know that which symptoms are appearing late. Those symptoms which are appearing the after even first hour of ingestion are of less important, but those who are appearing at 5 days or 5th day, okay, those are more important. Okay, so this succession of symptom and that duration of medicine. Why duration of medicine is important? So that you have an idea of in that case nux vomica, the case I have shared in your group, the nux vomica was working for 1 month. Okay, so it is giving me idea here in the table. It is only 1 to 7 days. Okay, it is giving me idea that it is working only 1 to 7 days, but this was an exception. Sometimes exceptions are there where the medicine act longer, and this action of medicine depends upon the pace of medicine, a pace of disease. If the disease is of slow character, the medicine will work longer. If the disease is of rapid character, even the medicine, I have seen the lycopodium finishes its action more or less very quickly. Lycopodium, you will see the duration of lycopodium is 40 to 50 days, and I've seen that lycopodium finishes its course, its action within 4 to 5 days, and that is the case. Sixth observation: medicine is finishing earlier. This means either the disease is of rapid character, you need to repeat, or disease is incurable. Okay, so of medicine. So you of the case. Okay, and there are some exceptions which I have told, and you need to know the succession of symptoms because the late appearing symptoms in the proving are more important. Clear? So we will end our discussion on primary action and secondary action here. You just go through aphorism number 65. Okay, 7 examples of secondary counteraction by yourself. 7 examples of secondary counteraction have been given. You just go through by yourself. We will start next day onward from 66. Aphorism number 66. Any question you are having, just ask me. If you have any question, you can ask.
Why are these late appearing symptoms important?
It has been seen in practice that these are important. This is the physician's observation, Hering's observations, Bonningson's observation. It has been seen in practice.
Sir, is there any importance in the selection of potency regarding the action of medicine?
Is there any importance? Yes, yeah, it can be. If you want to cure by if you want to give your medicine with secondary action, according to the secondary action, then you need to give in large doses so that medicine can produce the secondary action. That passiflora we are giving, some people are giving in mother tincture. Okay, like that. If you want your medicine to act on the secondary action, you encountered that will be totally ridiculous. Why you want to act your medicine on secondary action? Okay, but theoretically, think hypothetically, you want your medicine to act on secondary symptom, means secondary action. Give it secondary action. Okay, then you will have to give it in large crude doses. Clear? No. Okay. I think that Sunil have disconnected with us. So we will discuss it. If you have some more question, we will discuss in it next class. Okay. Thank you for giving your
Thank you, sir.
attention.
Thank you.